everyone. So this video, we wanted to share what we call the filing cabinet analogy. And we speak about it in our level 1 course, and how this analogy can help guide our thought process when working with people experiencing pain, especially when trying to make sense of their unique past injury history or their unique movement history, but also understanding what kind of strategies that we might use to help restore those robust movement qualities that we're after. So a couple of things to consider first is that we need to recognize that the brain ultimately lives within a dark cave within the skull. And the only way that it can gain access to the outside world or gain an understanding about the state of our system or the state of our tissues is by gathering information through our senses. You know, the brain is very predictive in nature, and this predictive capacity is very important from a survival standpoint as well, because it allows for a certain level of protection if necessary before something even happens. So before we even begin to move, it allows for that little bit of anticipatory protection. So it's more anticipatory control, if you like. So the key here is understanding that the nervous system uses the sensory information to generate estimations. So it always comes back to generating estimations of our body's capacity to handle stress. It's never precise estimations, or it's never precise understanding of what's going on, but it's more estimations through the collection of sensory information from the body and from the environment. And the easiest way to think about this is from a body region standpoint as well initially. And so if you imagine that the nervous system has a filing cabinet of information for each specific body region to help it generate these estimations. And the content of these filing cabinets serve as instruction manuals for the nervous system. So we obviously have the midline, the lower limb, and the upper limb. And each filing cabinet naturally will have different contents as well, because each region will express different behaviors on a day-to-day basis too. But we can look at it from a past injury standpoint too to help with the understanding. So let's say we have an individual with persistent neck pain that gradually developed over time. And let's say that this individual had a history of a humeral fracture on the same side of where they have their neck pain. Let's say they have right side of neck pain and they had a humeral fracture on the right side in the past. This past injury, humeral fracture, will be a significant component of that upper limb filing cabinet. And because the nervous system uses the content of that filing cabinet, not only to estimate the capacity of that region to handle stress and load, but also to understand how it can best coordinate control across that body region. And so let's say the individual didn't really receive good quality rehab after that original injury. So that experience, that injury, still remains a significant component of that filing cabinet that the nervous system will use to distribute control. And with that experience, with that past injury, the nervous system might not feel very comfortable allowing for a certain capacity to take place, a dissociation between the upper limb and the midline that we need to allow for the upper limb to reach outside the body's base of support. And that might be manifesting through increased muscle guarding, increased muscle activity around the shoulder neck region as a top-down expression of that protective control. And so a necessary component of treatment for this individual might be to go about trying to reorganize the content of that upper limb filing cabinet to ultimately change the strategies that the nervous system is using to interact with that upper limb, with that body region. Okay. And so we can also look at it from a movement experience standpoint too. So let's say we have a desk worker that sits for 10 hours plus per day, and they want to take up running, and they start a couch to 5K kind of thing, and over time they begin to notice some discomfort, some niggles and some pains in their knees and their hips, and they can't really understand why. Well, consider the content of their lower limb filing cabinet before they started. Have they really allowed their nervous system to experience that kind of movement behavior, movement at those kind of speeds, movement for that kind of duration, at that kind of load? And that spike in load may serve as a threat to the nervous system, because there's a mismatch with the content of their filing cabinet. And this mismatch may manifest through increased muscle activity, through increased protective tension throughout the lower limb, right? And so it doesn't mean it's a bad thing, but we might need to slowly reorganize the content of that individual's lower limb filing cabinet and provide a more appropriate instruction manual that the nervous system can use to make better estimations about the capacity of their lower limb to handle stress during that kind of behavior, that running behavior. And so what about self-talk as well? So this is something that we feel very few practitioners think about. The way you talk about your body will influence the content of these filing cabinets as well. So saying things from a client standpoint, saying things like, "Oh, that's my crappy shoulder. That's my my dodgy knee," or even having someone else, another practitioner, a doctor, for example, telling you that you have the back of an 8-year-old. Those words will become part of the relevant filing cabinet. So if it's about the spine, again, it will become part of the midline filing cabinet. If it's a upper limb issue, talking about your dodgy shoulder, it will become part of the upper limb filing cabinet. And that content will be used, that self-talk will be used to help the nervous system generate an estimation of the capacity of that region to handle stress. And this is why we feel it's so important to go about reframing how someone talks about their body, but also reframe what they may have been told by other practitioners as well. And so lastly, looking at it from a movement control standpoint. So how are the strategies that we're using to load the system with our exercise interventions influencing the organization of each filing cabinet? Right? So if we want a robust body region, we want an instruction manual that's easy to follow, right? And an instruction manual that has elements that can be ultimately used across many different situations to help simplify control in different situations versus an instruction manual for every single movement problem that might need to be solved. And so you can think of this from a standpoint of loading a client with far too many cues and getting them to control far too many elements of the system that they wouldn't really be able to control in a real world environment, in more of a complex, more uncertain environment, right? That's going to lead to a very messy filing cabinet. And nobody wants a really messy filing cabinet. Instead, we want a filing cabinet that has elements or features that will remain relatively unchangeable across different movement tasks. And this could be, for example, organizing our loading around the distal tissues, around the hands and the feet, depending on what we're going after. Because organizing movement around the hands and the feet, the distal endpoints, is a stable feature of most movement in the real world. And this can really help us alter the way that the nervous system uses the content within these filing cabinets. It can alter the kind of instruction manual that the nervous system uses to distribute control throughout the system. So we want an instruction manual that's easy to follow, but also allows for a little bit of flexibility versus a manual that has 100 different steps and needs to be extremely precise to be successful, because the nervous system doesn't really base control on precision, but it bases on estimations. We want to give it the capacity to make better estimations. So hopefully that gives you a sort of a new way to think about what we're really doing when we're integrating the nervous system into our treatment and rehab. It's not about being overly precise, but more so a process. It's a process of reorganizing the content of these filing cabinets to help simplify our movement control.